everybody, and welcome to our monthly lymphedema patient roundtable. Oh my goodness, there is so much positivity, so much energy, so much truth and wisdom and insight at this table tonight. I hope it just beams right through your screen and hits you in the heart at home, wherever you are. We know that you're logging on and we're so glad you could join us. Let me do my introductions of those that are at the roundtable. First of all, we are very honored to have a special guest with us tonight. Amanda Sobey is a health and fitness coach and a motivational speaker. Amanda, welcome.
Hello, hello.
Hello, and she also has lymphedema herself. So you might look at her and say, well, what is she going to tell me? She's got a lot to tell you, and she has a powerful story. So we're so glad Amanda's here. Our veteran fighting lymphedema, Kelly Bell. We're so proud and honored to have you. Hey, Kelly is going to show us how he does some breathing exercises to help with his lymphedema. So you definitely want to stay tuned for that. Catherine Rosenberg is recovering from surgery, and yet she still showed up. She is a cancer survivor, a lymphedema champion, and we're so glad to have you with us, Catherine Rosenberg. Mary Kastelberg herself, you know, we're real at the roundtable. We're not going to paint all rosy pictures that it's every day is sunshine and flowers. It's just not. Sometimes it's a challenge. Sometimes it gets the best of you. That's why we're here, to encourage you. And Mary is here, even though she had a tough week or so. Mary, thank you. Mary is a compression therapy consultant for Lympha Press. She also has primary lymphedema, and she has a great story and always great insights too. So thank you for being here, Mary. Okay, who have I missed? My Betty Westbrook. I know you've been writing to me and saying, where's Betty Westbrook? Like, we've had wonderful people on the roundtable, but there's something about Betty. You know, just like that movie, There's Something About Mary. There's something about Betty. She always brings such insight and wisdom, and in such a warm and human way. So she's going to answer your questions. Anything really medical, we'll defer to her. As you know, it's our practice not to give medical advice to anyone, but these patients are sharing their personal experiences in the hope of encouraging you. Angela Jones is a health and wellness coach herself. In fact, she just got done with a client and hopped on the roundtable. She has lipolymphedema, and she said those two don't like each other. Sometimes the one is winning out over the other, but she's still fighting and managing it. We always love what you share with candor and heart and wisdom, Angela. Thank you for being here. And my dear friend, I'll tell you what, you know who a friend is when they know that you need a friend and they show up. And they just let you know that they're there for you. And even in the midst of all Cam's going through, and he is facing yet another surgery tomorrow and a big one coming up, he's still here at the round table. You know why? Because his passion is his profession, and his profession is helping people manage their lymphedema with Lympha Press. And he also has a passion for uplifting the lymphedema community. So Cam, we love you, and we are so glad you're here tonight.
Thank you. What a wonderful introduction. Thank you, Brenda. We appreciate you. This wouldn't be possible without you. So thank you for all the moderating and the organizing and wrangling this all together. We know it's not easy. So thank you.
Oh, it is like the best party. It's like it really is a happy hour for me. Now, if you have questions, please, there's a Q&A here. You can write them in there. We'd be glad to field them. You can mention whatever you'd like to in chat. Everybody's monitoring everything. But I want to first go to you, Betty Westbrook, because we know your little boy might start having a meltdown any minute, and you might have to leave us. So we did have a few questions come in. One was from June Campbell. June, we're so glad that you wrote to us. And she asks, can I wear support hose when I'm pumping with my Lympha Press? And that question could be interpreted a few ways. So I'll just let you take it however you would like to.
Okay, thanks, Brenda. Thank you, June, for sending in your question, especially wanting to clarify, because safety is really important when you are operating, I guess you would say, your Lympha Press, or you're, utilizing that modality. So I would clarify support stocking. And so I'm going to say, if you're wearing a pantyhose type stocking or something that has no compression in it, then yes, you are fine to wear that while you're pumping. If you have a compression garment that is what you may be referring to as a support hose, then I would say do not wear your compression garment while you're pumping. And this is my explanation for that. And then I'm going to like flip it on you a little bit and talk about what kind of garment I would recommend wearing when you do pump. So if it's a like flat knit, circular knit compression garment on your arm or your leg, I would say don't wear compression and pump at the same time. And my reasoning for this is that your lymphatic system, your superficial lymphatic system, and because my arm is easier to see, I want to talk about it. It's really superficial. And so I like to tell people it's kind of like your lymphatic system is between two pieces of tissue paper. So imagine like a birthday party bag, you get tissue paper. So your lymphatic system is like right underneath your skin and your fatty tissue. And if you take and you squeeze what is your compression garment, that's just enough to help that fluid move up and out of the arm. But if you do double and you squeeze, it's going to do nothing but close that off. And so while you might be thinking you're pumping, you're actually kind of causing a little more inflammation and making your system work harder. And when you have inflammation, it makes more lymphatic fluid, then causes more swelling, and then it's a cycle. So if it's a flat knit, circular knit compression garment, that is your support hose, I wouldn't wear it. If you're talking about pantyhose or something that has no compression or like leggings, I think you're good because you want to wear a buffer between you and the sleeve.
Yes.
So to like flip it on you, a nighttime garment or something that's like a bulky, pillowy chip foam garment. Yes, thank you, Cam.
Thank you, Cam, for the visual.
He knew I was going there. Like this. You can wear that underneath your Lymphopress sleeve for upper or lower, truncal even, and it helps to really kind of like break up any of that fibrotic tissue that you might have, and it helps to move that fluid out. And it's because the nighttime style chip foam garment doesn't have that same gradient of compression, and it's softer and it massages it, and then the Lymphopress can help do its job and just get it out of there. So
do it out of there. I like that. That is a clinical explanation there, Betty Westbrook. And great. Thank you so much. I think that you really answered June's question so well, and we're so glad you asked it. We just had a question come in from Denise McCarthy. Now, of everybody on the screen here, now I personally don't have lymphedema. And of course, Betty Westbrook is a CLT. She doesn't have lymphedema. How many pump? Okay, you pump. All right, you pump. Now, Denise McCarthy is asking, and we're so glad you asked, how many times a day can you pump? And how long should you wait between therapy sessions? Now, we always add this caveat, do as your doctor recommends, right? But she obviously enjoys using her pump and is thinking, I'd like to use it more. So we want to talk anecdotally for those of you at the table. How many times a day do you pump?
I'll start. So it really depends patient to patient, right? And it also depends on your level of activity throughout the day. So if you're kind of homebound and you're not really moving around, or if you're the opposite where you're constantly on your feet and you're moving, and even depends on what type of daytime garments that you're wearing that Betty was just talking about. They had the flat knit and circular knit. So for me personally, I'm a nighttime pumper. I like to pump in the evening for an hour because that's kind of my bookend for the day, because I'm super compliant about wearing my daytime flat knit garments. So then as soon as I get out of the shower and I'm ready to kind of wind down for the day, I'll put on a nighttime garment, that foam chip material that Betty was just talking about. And then I'll put on my Lymphopress, and that's kind of how I end my day. For some patients, like a standard protocol is anywhere from 2 to 3 times a day. But again, you're going to want to check with your physician, because the biggest thing is we want to allow enough time for your lymphatic vessels and your veins to recover, so we're not just overloading them and constantly pumping. So I almost kind of associate it with, if you're at the gym and working out, yeah, you really want to get in shape, but you're not going to be on the treadmill all day long. You're not going to be pumping reps all day long. So it's important to give your body some natural rest in between cycles and sessions.
Great answer. I absolutely love that. Does anybody else want to weigh in on the how many times to pump? And go ahead, Mary.
So to second what Cam said, I think that it really obviously depends patient to patient. Sorry, I have a puppy who likes to chew bones against
I love it.
tables and stuff. So that's the background noise. So I recommend, listening to your body. I think that's the biggest thing for really any sort of treatment with lymphedema. You will learn what works and what doesn't for your body. So for me, I feel like my leg is most uncomfortable at night. If I have a really busy day, I'm going to pump at night after that day happens. One really cool thing about Lymphopress is it works well enough as dynamic compression that 1 hour in the Lymphopress equates to 2 miles of walking. So if you think about that, if you're really not walking much, or you can't walk, your legs are so swollen and they really hurt, and you find that you're maybe spending a lot of time in your recliner, do it those 3 times a day, because you're getting that movement of fluid that you wouldn't otherwise be getting if you are more active. Like Cam was saying, if you're up and moving all day, you might not need it 3 times a day, because if you're wearing your compression garments, naturally fluid is going to go up. However, we know that some people have a really hard time putting compression garments on, and some of us are not as active as others. So case by case basis, but and there's plenty of days. I was just telling Brenda, my leg has really been bothering me with the weather. Weekends, I'll get in it 3 times a day too, even though I am being more active, because you have to listen to what your body needs.
That's a really great overall tip. Listen to what your body needs, and always listen to your doctor too. We have Amanda Sobey at the table with us tonight, and you talked about the importance of movement, and your whole life is about moving that lymph. And what I love is Amanda's mission is to meet people where they're at. She's got a gym behind her, but you maybe not be able to get to the gym. That doesn't mean that just because you have lymphedema, you can't move. And what's your philosophy on that, Amanda? And by the way, hi, Nasreen. We're so glad you joined us. Nasreen Starner, CLT. We've got lots of brains at the table tonight. So go ahead, Amanda.
Can I just go back to jump in on the compression pump for how long?
Totally.
Because I also think like all these people are nodding their heads and we're all saying the same thing. Too much of a good thing is just seriously too much of a good thing. We all want the swelling to go down. We all want to reduce it, but too much of a good thing is just simply too much of a good thing. Also, don't attribute high compression levels to reducing the edema. You might want to be more at a moderate level to be a little bit more kinder to your body, to allow your Lymphopress or whatever pump that you do have to gently massage your body. And that might be a better alternative solution than cranking it up. When I first got my pump, which is a complete no-no. But yeah, for simple moving, I think people really express how important moving your muscles is to get the lymphatic system moving. Obviously, if you don't know, or I shouldn't say it's obvious, but the best way to move your lymphatics is through your muscles. So if you're sitting stagnant for long periods of time and you can't get to a gym, because unfortunately we're on lockdown right now, sitting in a chair and moving is good, or even lying in a bed is good. You can pump and flex those feet. You can pump and flex those hands. There's a lot of deep breathing exercises, which Kelly is going to talk to us about, but don't always attribute big, massive workouts to more effort or more success. You really have to start with where you're at. You have to really just start understanding what is around you that you can do, because if you can stick to it consistently, it's going to get you so much further than, as everyone has said, by just going to the gym for 24 hours a day, thinking that that's going to be your solution. You have to have a time to work, but you also have to have a time to rest. And moving simply in a chair, even when I'm sitting with you guys, I'm pumping and flexing. I really don't stop trying to move. And these small motions make the biggest difference in my health.
That is excellent. And I want people to know that you can get coaching from Amanda online. She's in lockdown in Canada. We're so glad you joined us tonight. How can people find you and follow you, Amanda?
You can find me on YouTube. You can find me on Instagram and on Facebook at am.sobey. I also have a website at www.amandasobey.com. And please feel free to reach out and send me a message if you have any more questions or any more information, and I'd be happy to help.
And she has a compelling story. I did a one-on-one interview with her. It's on our Lymphedema channel, YouTube channel. And your story is remarkable and you are an inspiration. So thank you. We're honored to have you here. She talked about exercising from bed. Catherine, you're joining us from bed tonight.
Yes.
So how are you managing your recovery from surgery with your lymphedema. There are a lot of people watching that are recovering from something. So what words of wisdom do you have?
So I actually contacted the company who does my Velcro wrap and had them do a little workaround for me to make it easier for the person who's helping me to put the Velcro wrap on. Normally when I use a Velcro wrap, I use the Ready Wrap, Solaris Ready Wrap. And it normally comes in 3 pieces. So you have your calf piece, your knee piece, and your thigh piece, and you can get a separate foot piece. Now, because you got to make sure it's on the correct way, putting those 3 layers on the right way, I'm like, this is not going to work to try to have somebody who is inexperienced working with a lymphedema patient who lives in your house to help. I contacted them and asked them to make me a Ready Wrap that is 1 piece from the ankle to the thigh, so there's no overlap layering happening. And that has been a huge success.
A lot of people wouldn't even think to ask. So I think that in itself is pretty interesting. And
I've had them do a couple things for me. A couple years ago, I wanted my tribute nighttime garment to be more adjustable, because I had the lymphatic surgery. So because I had the surgery, I wanted it to be kind of adjusting as my leg was shrinking, because I was only able to get these once to twice a year with my insurance company. So instead of having it just slide on my leg and it was just the size it was, I had them put Velcro panels on it that are like the ones that come when you get the over-the-counter tribute wrap. So they're nice and thick ones. And it would open and close. So I was able to really pull it tight as my leg got smaller.
Awesome. That's great. And we know you love using your Lympha Press because it is easy. The one thing we can say about Lympha Press, well, there's many things we can say, but what I hear over and over again from people is it's easy to use. You didn't need anybody to help you, Kelly. When you got your Lympha Press, you were able to do your own therapy yourself, which is a wonderful thing. Now we have some medical questions that have come in, and Betty, I know you want to answer them, but then I want you, Kelly, to show us some of your breathing exercises and why they're important. But Betty and Nasreen, feel free to jump in too. How does taking blood pressure or having an IV in the arm with lymphedema affect the lymphedema? This is Marilyn Kufner. Marilyn, we're so glad you asked. Take it away, Betty.
Thanks, Brenda. Thanks, Marilyn, for your question too. There have been like a Mythbusters little series about this, and it's kind of a controversial topic, and I don't mind stepping into that space, so I'll jump in here. Before, it was believed that if you had lymph nodes removed, or say you were recovering from breast cancer or any other sort of cancer treatment, that you didn't want to have needle sticks or blood pressure taken on that arm because it could trigger lymphedema. If you have lymphedema, your risk of a needle stick is the same as any other needle stick. You have the risk of infection. So anytime anything is entering your body, entering your skin, you have that risk of infection. And blood pressure cuffs, you may not get the exact same reading depending on how significant your lymphedema is on that arm, but it's kind of been like busted. The myth is busted that you can't have blood pressure cuffs taken or blood pressure readings taken or needle sticks in your lymphatic limb, I guess is the best way to put it, because sometimes you have to have like a pedal pulse on your leg or something done for blood pressure. And I don't know if anyone else wants to jump in on that. I just know that there have been some research studies done on it. And even amongst other CLTs, it's kind of a hot topic. And there are patients who will swear by, they will never, ever, ever have a needle stick. They will never, ever, ever have their blood pressure taken in that arm. And some people, you know, have had weird incidences where they did have an adverse reaction. But research and just kind of some studies on that have kind of busted it. So there shouldn't be an effect on your lymphedema. You do have that same risk of having a infection anytime you have a stick into your body.
Your little boy is weighing in on this.
He heard me talking and he's crawled right up to the door. He's really good at.
Wow. Well, you said you might have to jump up, but we really appreciate you weighing in on that. Nasreen, as a CLT, do you have anything you want to add to that? And by the way, I've also gotten a lot of questions, and this is common in recent months, about the COVID vaccine and should people with lymphedema get it in a different area, or so maybe this is a related topic. Would you like to speak to that, Nasreen?
Sure. Great question. So as far as needle sticks, blood pressures, all of that, again, it's been kind of anecdotal what we've seen, although I've seen it in my clinic time and time again. People who maybe have only had one lymph node removed, people who are at risk, and they come in after needle sticks or blood pressures. And so even though they do studies that show it shouldn't really affect it, we've seen patients come in, and it's typically really easy to kind of reroute if we catch things at an early start. More so what they're thinking is that these people probably have a prior, maybe a primary case of lymphedema that is unknown until there's been trauma to the system. And so we've had some of these patients end up getting some more ICG lymphography done, and then they're seeing that they actually had some problems beforehand. And so I always just err on the side of caution, just because I've seen, as far as the COVID vaccine goes, in our clinic, we're adding about 10 patients a week because they've ended up with swelling. And it doesn't matter truly if they're using their arm that is at risk or their arm that's had lymphedema. They could even be using the contralateral arm, or they could be using their arms and maybe their lymphedema is in their legs. And I think what's been happening a lot is the vaccine kind of sets off the immune response in the body. The lymphatic system is helping set up the immune system. And so we've just been noticing a lot of patients come in with swelling afterwards. And there is no scientific studies on this whatsoever. This is just what we've been seeing in my clinic. If you know you're at risk to an area, I would say avoid it at this point. Some patients who they typically are doing it in the arms. So if you know you're at risk for your arms, I've been having patients get it in the legs.
Well, okay. So that is an option. And can a patient request that?
They definitely can request it, and you just have to really be your own advocate, because there are some people who've told me that they really had to just be absolutely not, I cannot get it in my arms, both of them. Maybe they've had axillary lymph node dissections on both arms, and they're like, give it to me, maybe anywhere below the waist.
Gotcha. Well, I'm hearing a common theme here, being your own advocate and asking questions, and even asking for, in your case, Catherine, something special. You're worth it. Every one of you out there, you are worth it. By the way, I hear we have a rock star with us tonight, Amy Rivera, Ninja Fighting Lymphedema. We all just love you and are so glad that you are out there. We need to have you on the next roundtable, I think. Kelly, tell me why breathing is important for you and for patients with lymphedema. I mean, not breathing. I mean, we all have to breathe.
Breathing so you can stay alive.
Breathing is not
That's
optional.
it. That's it.
But the special kind of breathing that Kelly does. Tell us about your special kind of breathing.
Well, I'm going to kind of like when Amanda talks about like exercise and like your muscle squeeze and everything. When you get in here, you really, like in your trunk and everybody, I don't know if anybody knows, I'm going to step back a little bit. My damaged lymphatics are like right below my xiphoid process to about up in here. All this is either full of plastic or damaged. So, and what happens then is when I exercise, you get all that fluid in your trunk. And so I help patients all the time, because when you think you're going to be able to move that lymph around, from what I saw from my quote unquote 25-hour lymphoscintigraphy, is the central lymphatics, where my lymphatics damaged, they don't flow out of there. And so what happens is what I do before I get my pump, I do this breathing technique to where and I'll step back. I literally take and I fill my lungs and I tighten my abdomen.
I'm doing it with you. Are you guys doing it with me? Okay, let's do it.
Tighten my abdomen.
Kelly. And everybody at home, you do this at home too. Go ahead.
And then relax your breath. Keep your abs tight, because those are the only muscles in this whole area to help your lymphatics. And actually, there's no tool really to help move the lymphatics from here in my damaged area, except for you contracting those lungs. And the reason I'm finding this very important to tell people is like, I get emails all the time from people, even therapists, who are having trouble with a patient, and especially people who have like ovarian cancer surgeries, or a friend of mine that I've met in Canada, Renette, who had bladder cancer, and they literally took 41 lymph nodes all the way the last part of the routine is to incise the diaphragm and take lymph nodes right under the xiphoid process. And most therapists push on the abdomen, and like what happens then is the logic is like, oh, you can just move it around. You can move it around if it's in the subcutaneous region. But from my experience below, like when you're in the central lymphatics, it does not move. Like I said, they had me come back the next day because they were amazed about how blocked it was. And it did not move. It was just sitting there kind of, and you just saw one little string coming up and doing its little thing. So what happens and what I see is like during the MLD is if you push too hard, you're going to wind up pushing that towards the genitals. And then you have genital swelling and stuff. And then, because that actually does dump more into the central than it does the subcutaneous part. And so for me, what I do before I get in the pumps, and I think I've expressed to Cam in this in the past, my greatest fear is pushing it towards my genitals.
Sure.
Because I've seen and talked to so many people, and I actually have had my scrotum swollen, my rectum.
You know,
all
this is real talk, folks. And the truth is, we know we're helping someone out there who might say, gee, I noticed something, and he's saying it. We're not afraid to say it. This is about your health and well-being, and we don't mind going there. So thank you for raising this, Kelly.
Right. And like Renette's issue, I hope I'm saying her name correctly, Renee, is that like when she sits for a prolonged period of time, she swells. I don't sit for long periods of time, not at a 90 degree ever. And if I do, like if in a long ride, I use that breathing technique, not like, I just do it every few minutes to help my lymphatics, to help that clear that out, to give that fluid a place to go. Because like I have lymphedema everywhere, but here, if I keep this clear, it keeps it. I mean, you can literally, if I get in a Lymphopress pump and my arm is swollen, my hand, like this ring I'm taking off, this is my key. If I'm swollen, this won't come off. Within 20 minutes of laying in my Lymphopress pump, after doing this ring will fly right off. And that's just compressing on my abdomen and my legs.
And that's good news. That's
good.
Yeah. That means you're eliminating that lymph. Excellent. Thank you for sharing that, Kelly. We appreciate that. We do bring the real here to the lymphedema patient roundtable. And I said to Angela before we got started tonight, I said, so how you doing? She said, this is the truth. Dealing with lymphedema is something you deal with every day. It needs to be managed every day. And you're not just managing the physical, you're managing the emotional, the spiritual, the mental challenges of it as well. So you always bring the real, Angela, and some encouragement. What would you like to share with us this month?
Every day is different. What worked yesterday may not work today. I'm finding that out more and more. And it's very frustrating. Even down to food. I can eat something today, I don't swell. I eat it tomorrow, I swell. So I want everybody to be aware, don't give up if today is so different from yesterday. And if today feels like, oh my gosh, I'm getting nowhere. I was doing well yesterday, just hang in there because it's a change for me. And I think for everybody, almost every single day.
You know, one of my favorite phrases is this too shall pass. All go through challenging and difficult times in our life, whether we have lymphedema or whether we don't. We all face challenges, but they are temporary and life is cyclical. It's not linear, and you will get to the next stage. And you know what? Even the good times, this too shall pass. So savor the good times. When you're in the midst of a good time, let it sink in and let it be juicy and good, because this too shall pass. You also are in Arizona right now, and heat is a thing.
Oh my gosh. It is so hot. I live between here and North Carolina. So I think I'm going to go to North Carolina probably in the next couple of weeks, which won't be any better because of the humidity. Here in Arizona, there is no humidity, but we've already gotten into 100-degree days. And so it's very hot, and it makes me slow down because immediately once I step into that heat, the swelling. So like I was saying earlier, I have to get up, you know, I'm at the park at 6:30 trying to walk. I'm the only one at the park trying to walk. So I've had to come up with some alternatives to the park. I prefer just outdoor walking, but I've had to come up with some alternatives, and I've had to just accept, okay, here is where you are.
Yeah.
You got to deal with the heat because you cannot make it go away. So I just find my way every single minute. I'm trying to find a way. So
there might be people watching tonight that have been newly diagnosed with lymphedema, and it's starting to get hot where they live, and they're thinking, why is this bothering me? You know, Cam, you live in Houston.
Yeah.
oh,
Yes. I'm constantly reminding patients that I have the privilege of working with that there is a seasonality of lymphedema, and being in Texas and these cities and states that is very hot and humid. I say, look, like your friends and family who may try to take off their wedding bands who don't even have lymphedema, it's tough for them to do that because our bodies naturally swell with these hotter and more humid temperatures. So really for me, and I think really anybody on this panel and roundtable can agree is that lymphedema is really one long game of trial and error, right?
Mhm.
Things that used to work for me when I was a pediatric lymphedema patient don't work for me as an adult because my body changed, my lymphatic anatomy changes, right? So that's one thing to just really keep in mind. I mean, I'm type A personality. I love a routine, and I get so much anxiety when things don't go a certain way that I don't have control of. But I think you have to accept that there are things with your lymphedema you can control and things you cannot. And when you cannot do it, have a plan B in place. Know the right resources to reach out to so you can, you know, mitigate risks of infection or any flare-ups or any other complications that may come with your lymphedema or lipedema for that matter.
That's a really good point. You know, what worked at one stage may be different next time around. And it's like trying to put a square peg in a round hole. Wait, this worked before. How come this is not working now? I saw a lot of you nodding when everybody was talking about the changeability of this condition. And it's something that you really are surfing every day. Anybody else want to speak to the mental, emotional challenges of lymphedema? Go ahead, Kelly.
I just want, I mean, I've been dealing with this for 16 years, and 12 years of that was a down spiral. Okay. The last 4 have been good. And I will tell you, the last 4 make the first 12 worth it. So just stick to it. We're here to help everybody on this panel, the therapists, all of us doctors. They're learning more and more. And so just, it could be a long ride, but hey, it's worth it. I'll tell you that.
We're so glad you got to the other side. Amanda, go for it.
I think Kelly and everybody else can attest is that consistency is key. You will get frustrated. I think you will beat your head up against that brick wall, but every little step that you can do, and Angela, what a beautiful explanation of like, I got to get up at 6 o'clock in the morning to go beat that heat. You do get out of it what you put into it. So for anybody that is watching, don't give up. I'm so happy that you guys are here. We are all different examples of thriving and different examples of learning, and just keep on doing what you got to do. And as Cam said, create your network, create those people around you that have gone ahead of you, who are knowledgeable, that can keep inspiring you. And if it doesn't work, don't throw all of that hard work that you've done away. Keep what works and find something else that does.
That's such good advice. Go ahead, Catherine.
Other thing to keep in mind is that sometimes you do have to give that change a little bit of time to see if it's going to work, because the first time that you change something, you may get a negative reaction. But in the long run, after you give, I'd say to give it like 2 to 3 weeks just to see, is that change really worth it? Because sometimes your body has to adjust before it can react in the opposite direction that it's used to reacting.
That
Good
is
point.
really wise. Good information. You know, Mary, before your puppy dog showed up on the scene, I saw you kind of nodding as well on this topic of the emotional well-being and managing the ups and downs of the condition. Did you want to jump in?
Sure. I was actually talking to a doctor the other day And I told my story and he was like, wow, I would be so depressed. And I was like, I was like, don't let me being positive now take away from what it was like when I was younger. You know, as Cam said, especially, sorry, I have 2 dogs and they're playing with each other. But you know, especially as you change, I was also diagnosed as a, you know, adolescent diagnosis. So your body changes. You also just grow a lot emotionally. And I don't think no matter when the diagnosis happens, I always tell people feel what you are feeling because it's valid. It's going to change. It's going to pass. There are so many people who have asked me, you know, would you go back in time and choose to not have it? And I would choose it every single time, because it has taught me so much, and it just takes that time now. So.
Oh, and it's made you such, you know, our pain makes us more empathetic toward others, and it's deeper. You know, we become deeper people. We have a question from Vicky Wernecki. I hope I said that right. It's a fun name, Vicky Wernecki. I like that. I hope that's how you do pronounce it. And I'm going to pose this of you, Nasreen, because you are the certified lymphedema therapist. Now, we are not giving medical advice in any way, shape, or form. First of all, she's cancer-free now. So we applaud her. Yay, Vicky. Now, she has lymphedema on her left arm after breast cancer surgery. And she has noticed that she had another surgery. She's noticed that her throat is more swollen and wondering if that's related to the lymphedema. Might there be a connection there, Nasreen?
So without Vicky, yay on being cancer-free. That's very exciting. Without knowing, I guess, the full history of your breast cancer, it's a little challenging to know. Sometimes when they'll do a full axillary lymph node dissection, if that is what you had, because they're removing those first 2 levels of the lymph nodes, sometimes some of your lymphatic drainage automatically goes up towards your neck. And so if your body has naturally been sending fluid, just rerouting it on its own up towards those cervical lymph nodes, what can happen when there's been trauma to that area is that it can cause some swelling there. I'm not sure too, if maybe you had a port, if there was any chemotherapy involved, because sometimes there's been some trauma just from the port placement as well. So I do apologize because I'm unclear, but I definitely have seen patients with chemo, radiation, lymph node dissections who have had, even without any throat surgery, have additional swelling up in their neck.
Gotcha. So it may not be uncommon. Always check with your doctor and ask that question, but we are very glad that you posed it of us, and we were glad to celebrate with you that you are cancer-free. That's wonderful news. We had a question come in from Joyce Tyler. This was prior to going live tonight. And Joyce wants to know about physical therapy for lymphedema. She has truncal, chest, breast, and back lymphedema after radiation. She says she didn't realize how much physical therapy could change her life. Who would like to speak? I see you nodding, Amanda. Tell me about physical therapy.
Yes, I think movement is key, but it's not, what's the biggest, movement is controversial because not every exercise fits every body. So also too, a lot of therapists too out there, many are not familiar with lymphedema, and even personal trainers are not familiar with lymphedema. If you get really aggressive exercises, or if you get things, even if it's a physiotherapist that does exercises with you and you don't really quite feel confident or don't feel able to relate with them, please keep looking. Find somebody that can work with you, is knowledgeable about your disease. And we do, I think, all highly recommend movement of some sort. You might want to look into swimming, which is an amazing exercise to help move the lymphatics. That's going to be easier on your body instead of jumping right into more aggressive training. But I think the key points that I would recommend from my profession of being a personal trainer is make sure that they have familiarization with the disease. Make sure that you relate to them and can understand them and work with them. If it doesn't feel like it's a good fit, it's not a good fit. keep moving on and keep looking for better advice and things that can help you move that lymph, and it can be done.
You don't have to marry the first guy you kiss. Hey, you know, it doesn't mean that you give up on dating. You just keep trying until it fits. And I think you're absolutely right, Amanda. That's good advice. Anybody else want to weigh in on physical therapy, who has done physical therapy or how it's helped them? Go ahead, Kelly.
I have done. Oh, yeah, go ahead, Kelly.
And
Go ahead.
then Cam.
Well,
I was just gonna.
Go ahead, Cam.
No, you go. You go.
No, you go, man. You got it. You got
Oh,
it.
you hang up first. You hang up first. Okay.
Oh, you got it.
I will speak from someone who's had now 15 surgeries on one knee, and it's the knee of the leg that's had lymphedema. So to echo what Amanda's saying, the biggest part for me recovering from these surgeries, whether they're minimally invasive or pretty majorly invasive, is movement. And now my modalities have changed quite a bit, right? So when I was a young, kid in high school and then playing college basketball, my physical therapy routine changed pretty drastically to what it's going to be after I get my knee replacement next week. So I recommend that's helped me personally is instead of doing the treadmill at the gym, I'll do an elliptical machine because it's lower impact and it's not as invasive on my joint. We talked about, swimming is another great modality for lymphedema. So really just find that trainer that's going to understand your condition and customize to you. And that's another great thing about the Lymphopress Optimal Plus is it customizes to your specific needs. So quick plug there for the Optimal, which has been great for me recovering post-op. I've been able to adjust pressures per chamber to accommodate for my needs that have changed from when I originally received the device 2 years ago.
Yeah, it's so awesome and so technologically advanced. And you can be in your bed or in your recliner and operate it from your smartphone or iPad. So cool. We love that. Kim, we do want to ask, you're going into surgery tomorrow. We're sending prayers and good vibes your way. Is there any update that you can give us and anything we need to be keeping in mind, or maybe something that would be pertinent to the lymphedema community?
Sure. So tomorrow is just a minor procedure, which is basically going to determine which major surgery I get the following Wednesday. And I think it's really important, regardless of what type of orthopedic surgery you may be receiving, that prior to that surgery, when you're speaking to your orthopedic surgeon or the nurses who you know are going to be in the OR, that the post-operative compression wrapping that they do to, let's say, your affected lymphedema limb is so important that they understand not to do the gradient too tight. Unfortunately, cautionary tale from my last surgery I had in March, they were not aware of that. And they did it so tight, I ended up establishing a very painful and very large pressure ulcer on my upper thigh. So again, it's just like we talked about with knowing, physical trainers being aware of your condition. Make sure if you're getting any type of orthopedic surgical procedure, that whole team is aware, because post-op is very important, because you can actually make the lymphedema worse if the team is not aware of those post-operative protocols.
That is brilliant. I'm sorry that you had to learn that the hard way, but what you're saying is helping many people. Remember, you got to be your own advocate and bring your own wisdom to the table. Kelly practically has a PhD without formally having one. You know so much about the lymphatics. Thank you for sharing that, Kim, and we are with you, and we're so grateful for you and what you do for the lymphedema community. Did I mention, or I'm going to mention it again, that he got a Courage Award from the Learn organization this past month, and he is courageous and kind and wonderful. We love you, Cam. So we had a long question come in, and I'm throwing it to you, Amanda, because you are our health and fitness person here. And it's sort of like a quick roundtable of should I, shouldn't I? Okay, question, how can someone rate how effective and how many times a week we should do any of these? So quick answer, trampoline or rebounder?
Listen to your body. It depends on which stage that you're at. If you are going from very stagnant lifestyle to trying to go all aggressive, start with once a week and be consistent with that. It all depends on your personal well-being to start with, and go a little bit further every little day. Just move the goalpost an inch. Next
Yeah,
question.
We have to, yeah, well, I think we do have to add this disclaimer, like we can't answer that question for everyone. We don't know you, but we love you and we're so glad you're here. We can offer general guidance, but this bottom line is listening to your body. The next one is swimming pool. And I'll go to you, Mary, in just a second. Swimming pool.
Is that me or is that Mary? I don't know.
We'll go to you, Amanda. Answer swimming pool and then I'll go back to Mary.
Same thing. Again, if you, depending on where you're currently at in your lifestyle, I think it's a really good understanding of what does your current lifestyle look like. If you going to the pool, going for 5 minutes a day is pushing it, just start with that 5 minutes a day, and then you can always progress as needed. I think obviously looking for professional advice, somebody who has gone ahead of you, who is familiar with the disease. I love training. I love teaching people. Please feel free to check me out because I can talk to you more behind the scenes and ask you more questions. But everybody always wants to know what's the best exercise and for how long. And my personal advice is do what you love, do what you think is effective, but listen to your body as for the duration and always seek professional advice.
That is great. And Mary, what did you want to say about, were you speaking to the trampoline rebounder or in general about me?
In general, I think it's important to really keep in mind that lymphedema is a condition that changes all of the time. So it's really important as you increase your fitness to only compare yourself as this is my journey and this is where I started. Just because I was super fit a couple years back, every single time I had surgery, I started back at zero. And it is okay to start back at zero because that is our story. So, you know, I actually just messaged Amanda a couple days ago and was like, hey, have you tried
That was you?
That was me. Hi. I forget, it's not my actual name. But so you can try different things, but keep in mind, you know, things that I've been doing for 3 years now, sometimes I have to back off because my leg decides it doesn't like it. So I think the big takeaway is try whatever, but don't have that standard set for yourself. Even if you've reached a certain level before, your leg and your arm or your situation might change where you need to take it down a couple of levels, and that's okay.
Great advice. And so this list goes on with cardio, weights, vibration machines, skipping rope, balance fitness equipment. My favorite, dancing, because you can always chair dance, right? Get a little. Right? Come on, Kim, you've never chair danced? What?
No comment.
No comment. All right, man, I'm going to get you all to dance with me one of these days. And then the final question was the use of the Lymphopress. On the same day that I've done some physical activity, can I use the Lymphopress? Go ahead, Kelly. Whenever he does this, I know he wants to speak. So go, Kelly.
It is crucial for me to use Lymphopress with my after activity. And one thing I like to do is try to get my lymphatic system energized prior to getting in it. If I'm already a little warm, cool off, rinse, I get right in it because it's already ready to go. Like if I've done a lot of activity, use like your circulation, your pulse rate, and it's up because all that helps move lymph and it makes it way more effective. So yes, Lymphopress after working out, what keeps me going.
And I hate to interrupt, but that list, it sounds very much that you see those lists being posted in lymphedema support groups, and those are your options. That doesn't mean you have to do every single one of them. Start with one thing. Do you like it? Do you feel like it's helping? Great, stick with it. If you don't like it, throw it away, move on to the next. It's not an absolute, you must have to do all those things every single day. This disease can like completely drive you insane.
Right.
Do what you love, listen to your body, work at your own pace, and call for professional help when you feel like you get stuck. Or talk to other people that you trust their opinions for. Like this Roundtable is amazing. Look at how many awesome people there are here.
I know, I'm loving it. And I mean, this is my happy hour every month. And, you know, I got to say, the reason why Lymphopress is so successful for people is because people like to use it. It feels good. It's easy to use. They see results. If something's going to do that for you, you'll want to use it instead of putting it in a closet where it can collect dust. And so the same with choosing your ways to move. My sister has gotten me to try to jog for years. I would rather have root canal without Novocaine. But get me in a Zumba class,
Oh yeah.
I can move it. Thank you, Amanda.
Hey, Zumba off the list. Next.
Yes, that's right. It's a Nasreen, you didn't know it was a dancing night tonight. It's a party, it's the happy hour. So listen, I want to ask, what is the one thing that you wish you knew about lymphedema that you now know? Now, Cam, you shared a really important story about the wrapping after compression. Nasreen, I'm interested. What is the most common mistake people make when they are diagnosed with lymphedema?
So we see a lot of patients right after they've had quite a bit of swelling. And then once they reduce their swelling and we get them into some nice garments, that they do not get new garments. And they wear their same old garments for, month after month is okay. But when it starts to become year after year, and then they come back to our clinic, 3 years later, wearing the same garments that we got them years prior, and it's not containing them, that's probably the biggest thing we see. So it's going to be one of these things where you're constantly having to keep up with getting new compression garments and managing. And I think the other thing is that people just don't come back after a certain point, because I get it. They want to get on with life and they want to manage, but I know you were saying it's like 100 degrees in Arizona. It was just snowing in Cleveland this past weekend. So, but with weather changes and stress in life and everything, your lymphedema can change so much that I actually like to have our patients come in after we have them completely reduced and in their garments every 3 months, so we can kind of check on them and make sure they're doing all right.
That's such a great point, because sometimes when you see results, you're like, okay, I'm fine now. This is a chronic condition that needs to be managed, and you can't just sit back and not manage it. And getting those new garments. Anything else that anybody at the table wish you knew then what you now know? Go ahead, Catherine.
So to kind of chime off of what Nasreen had to say, I didn't know what my coverage was on the amount of garments I can get per year. And after learning that, I'll be darned, I make sure I order that amount every time, as many times of the year as I can. So this way I'm constantly rotating and able to wash them every single day. So luckily for me, my insurance company covers 4 sets every 3 months. So I don't have to worry about the overstretching or is it going to be too big on my leg because my leg has continued to reduce down, because I'm getting them so frequently. So the biggest advice I can say is, a lot of times it's not directly written out in your policy that you have in writing. Call them, ask them, what is the policy for customized compression garments for lymphedema? Find out the quantity and how it needs to be written.
Drop the microphone. That's good information. What about you, Kelly?
I'll be honest with you. What I wish I'd known is people like you. I mean, I never, when I got diagnosed, I didn't know what lymphedema was. I didn't even know what other people that had it. And that first 12 years of having it was hell. Then after I met people, it became a journey with a group of people, which was much better. And
we write back at you. And the reason we do these roundtables is because we don't want you to feel like you're alone. Any one of you. Lymphedema does not have to be lonely. Connect with all of us. We really care and we're excited to help. Go ahead, Amanda.
I'm going to piggyback on everybody. I don't have coverage. I don't have insurance. And in my province up in Canada, they don't cover massages or garments. And this is why I want to band with as many people as we possibly can. I think it's not only a statewide or a provincial wide issue. I think it's a global issue of getting proper compression getting proper therapists, getting proper devices. And I really hope that the more that we work together, we can start changing policy, because not everybody is covered by insurance. And that's why I don't change my garments regularly. I am a full-time single parent of 2 kids. I have to choose between putting food on the table or my compression, and the food always wins. So I think it needs to be changed. And I hope that the more that we work together, we can definitely make a difference.
And you did a lot for World Lymphedema Day and Lymphedema Awareness Month to bring all the different parties together. And I think if we all continue to work together, we can affect change. My heart breaks that you don't have the coverage to take care of those needs. And that just shows that it's not one size fits all. We all come from different places with different situations. Maybe you're in the heat of Arizona or the cold of Cleveland, or whatever your situation is. But the point is that we can link arms together and help and answer your questions. Angela, did you want to share anything before we run out of time?
I wish I had realized how easy it is to be gullible. And by that, I mean, I really got heavily into this supplement helps, this supplement helps, this supplement. Yesterday, I threw out a garbage bag of supplements because I fell into a trap that I've always avoided. And I fell for the magic pill trap. And it's not easy. It has to be, there's a process, I mean, and there's a journey. And it just has to be taken. And I just kind of stepped away from that. And I got really, really frustrated because I wanted something to handle it and handle it now. And that didn't work.
Can I have some snake oil to fix me? I get you.
Yeah.
I think that's really wise. I think it is easy to be gullible because you're looking for hope, but there are practical answers like getting a Lymphopress and managing through pumping like that. Go ahead, Cam.
So I know the question is, what did you wish you knew then that you know now? Well, I would just like to share what I do know now, because I think for me, one of the favorite quotes that my basketball coach told me when I was little is, and it didn't really hit me when I was younger, it actually hit me, this year as I started to have, more issues with my leg. And, I think with our lymphedema, when we have flare-ups, when we have bad days, we kind of play that whole, woe is me, why is this happening to me? And as Mary said, and as I can contest to as well, those feelings are real. I encourage you, feel those. It's important. It's part of the coping mechanism. It's how we grow as individuals. But what all that to say is there are 2 things that you have control over, and that's your attitude and your effort, right? So you can choose to, be a compliant patient, because that does take effort. Lymphedema is not an easy condition to have. I'm not going to sugarcoat it. It requires daily management, right? So whether you're wearing your garments, you're pumping, seeing a therapist, that takes discipline and that takes effort. And you have control over that. You can choose to do those things. And then the second part is the mental part of having a good positive attitude. And days when you have, a bad attitude, know that there is a community here that has felt those same emotions and, can be that shoulder to cry on. I mean, hey, real talk, I was crying my eyes out when I was in excruciating pain, and I called my brother Kelly Bell, and he was there for me. And it got me through when I was not wanting to go on with my life, because I know he's been there too. So again, this community is here for all you guys. And when you think you've had it worse, there's others out there who've had it worse. So again, let's link arms together.
That was hard, brother. That's all I'm going to say.
Yeah. So I'm linking arms. I'm sending hearts. We are out of time. The hour flies by. Thank you for honoring us by joining in for this happy hour together, the Lymphedema Patient Roundtable, and to all of our amazing panelists. You bring so much wisdom and heart and insights. Thank you, Amanda, for being our special guest tonight. Thanks to all of you. Have a great month, everyone. We'll see you next month. Take care.
Bye.
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 Great night. I loved it. Always love it. See you guys. Bye,
you.
everybody.
Bye.
Bye.